A ghost town. That is how some are describing two New York City hospitals tonight.
Thousands of nurses from Mount Sinai's main campus in Manhattan and Montefiore in the Bronx spent another day on the picket lines. CBS 2's Bauman live in Norwood in the Bronx with the latest on the negotiations and more on that impact on patients tonight. Allie.
Maurice and Christine, the nurses union has been at the bargaining table with both hospitals all day. But at this hour, there still is not a deal for either. Since the beginning, the union's top priority has been hiring more nurses. They argue both hospitals are dangerously understaffed. And now with all these nurses on strike, patients tell us the hospitals are unrecognizable. For a third day in a row, thousands of nurses from Mount Sinai Hospital in East Harlem and Montefiore Medical Center in the Bronx spent Wednesday on the picket lines instead of at the patients' bedsides.
We're really hoping to settle tonight. We think we're close.
The hospitals are diverting some patients to other facilities while also spending millions of dollars to bring in traveling nurses during the strike. But patients' families say it's not enough.
It's a ghost town up there.
Every day, Jennifer Barrera visits her sister-in-law, who's a cancer patient at Montefiore, and is now being treated by the traveling nurses.
They're nice, beautiful people. Problem is that they're not trained in cancer treatment. So now we have my sister-in-law who just got a bone marrow transplant who has to help the nurses administer her own medication.
Marilyn James has been visiting her son daily in the hospital for the past month.
Does it seem like there are enough nurses in the hospital right now?
No, there isn't. But it's nothing like having the Montefiore nursing department that they're just cohesive in situations like this.
Despite a promised 19% pay raise from both hospitals, the nurses maintain they will not return to work until the bosses hire more staff. Mount Sinai has proposed staffing grids, and Montefiore offered to add 126 nurses, but there are 500 nursing vacancies at Mount Sinai and 760 at Montefiore, according to the union.
When you have to drive from the Bronx to Westchester County to be seen by a nurse that can take care of 7 patients versus the nurses here that have to take care of 15 or 20, it's not nice.
The union is also fighting to keep a nursing program at Montefiore for high-risk mothers. The Bronx has one of the highest maternal mortality rates in the country.
We're kind of filling that gap that's between, the healthcare system when they go to the doctor's appointments and when they're home.
A hospital spokesman told us mothers currently enrolled will continue treatment, but they no longer have the grant dollars for new patients and continue to actively seek new funding.
It would take $800,000 to keep the program going, and Montefiore simply has said that they are not willing to do that anymore.
Negotiations at both hospitals continue.
Do you think it's possible that nurses go back to work tomorrow at all?
I hope so. If all goes well, yes. If not, we'll be out here again.
Mount Sinai also says a proposed staffing ratio similar to what the other 8 hospitals have that did come to contract agreements. And throughout all this, both the hospitals and the union have been urging patients not to delay getting medical care if they are sick. We're live outside Montefiore Medical Center in the Bronx. Bauman, CBS 2 News.